So today's guest is Dr. Eric Exelbert, who's the Pediatric Intensive Care physician. He also sees his patients in a medical practice called ExAlt MD. He's also the medical director for Fluent Cannabis Care. Dr. Exelbert, welcome to the show.
Thank you very much for having me.
Thank you. So you wear a lot of hats, and they all seem very complicated and interesting. Tell us a little bit about your day-to-day activities and how is it that you arrived into cannabis medicine?
Sure. Well, I, as you mentioned, am a pediatric intensive care doctor, and that's pretty much my main gig of what I do the majority of each week. But I did my training in Denver, Colorado at Denver Children's Hospital. And I was there between the years of 2003 and 2006, and then began my medical career as an intensive care doctor there. As most people know who follow cannabis, was sort of the hallmark states where things were beginning. And so as I was beginning my medical career as an intensive care doctor, the city, or Denver or Colorado in totality, was going through a massive transformation in cannabis. Cannabis has been a part of my life, most of my life, through personal use and learning about the medication. And so I was always interested in where that was going, what was the science going to bring to my life. And then ultimately moved to South Florida in 2010, where I grew up and where I'm from. So I had a little bit of an introduction in Denver, and then I live in South Florida. I practice in a town called Hollywood, Florida, and work at a major children's hospital down here. And over the years, as cannabis has sort of taken over the country from a medical standpoint, I then wanted to continue with how could that be a part of my everyday life. One of the difficulties, as most people are aware of it, when you work in a hospital setting, especially with very sick children, teenagers, adolescents, it's a little bit difficult to bring medical cannabis to the hospital setting. So basically, there were individual patients. The first major patient, to be honest, that sort of really brought me to the forefront was a little boy with an inoperable brain tumor and had refractory seizures. And I was becoming close to a company down here that was a hemp-derived CBD company called Green Roads, which has become quite large. And to make a long story short, I recommended to the family through the neurologists and the neurosurgeons that there really might be other aspects to what can help this little boy. And so we created a relationship that ultimately then started having about 5 to 10 children that this company completely sponsored. And it showed me firsthand what some of these patients were able to, number one, have improvement of their symptomatology and disease process. And that was sort of my introduction. And so my next phase was, well, how can I do this in a setting where I can learn more and actually practice? And lo and behold, medical cannabis became legal in Florida. And so I'll spare the long details, but over the course of about 6 to 8 months, became licensed, continued to do a lot of research, continued to recommend, at least at that point in time, hemp-based CBD to some of these refractory children, and then ultimately opened up my own clinic, ExAlt Med, and did that pretty much on my days off. And I started mostly doing what I would call concierge medicine, driving around, seeing all these people at their homes, learning from them as much as they were learning from me. And that just continued to go from there as medical cannabis has taken over Florida.
Amazing. You talked about a lot of different concepts, so I wanted to unpack them just a little bit. When you talk about refractory, what do you mean if a patient is refractory?
Good question. So refractory is a nice way of saying that if a patient has a disease process or symptomatology, so symptoms like headaches or pain, a disease, I would say something like epilepsy, where that is a seizure disorder. So what's going on in that patient's medical history is that they're having seizures that are not being controlled efficiently by their medication. So we would then say that they have refractory epilepsy, similar to a patient that may have migraines and get headaches, which are very difficult to control. And despite being on medication, whether that's prophylactic, meaning trying to prevent the medication, trying to prevent the migraines from coming on, or when the migraines come on and then using various medications that can be used for that. Refractory would then be where that, despite medical management or diet management, whatever that might be, they're still having symptomatologies. Probably the best example that I would give in a non-medical or maybe just a different way would be someone who actively exercises and may have a little bit of a sore elbow or a sore wrist. And despite being able to work out, they continue to have these issues despite backing off, taking non-steroidals like ibuprofen. And so they have a refractory injury that just does not continue to get better despite whatever they're doing.
Okay, awesome. So when you see children that have refractory seizures, how often are they getting their seizures?
That's another great question. So in pediatrics, most specifically, there are some genetic syndromes where patients can have literally up to hundreds, let's just call it, of seizures a day. Wow. Now, that does not mean most, and let me just rewind a little bit. Most people feel or think that a seizure is when the whole body is shaking very stiff, like you see in the movies, or if you've unfortunately seen it in real life. But seizures can come in all shapes and sizes. It can be as simple as you and I having this conversation, and over the course of 5 to 7 seconds, you might not even know, and you're asking me a question and there's a pause, and I might just stare and have no idea that I'm staring and then sort of bounce back. That would be something called an absent seizures, meaning there's no visual thing that you can see when someone's having a seizures. But to go back, there are some people that can have literally hundreds of different types of seizures to patients that might have a seizure once a week or once a year. But that once a year in somebody who has a job or in somebody who's a parent might be catastrophic.
Right. Or
so
driving,
really,
right?
Yeah. I mean, there are people who have been seizure free who haven't driven for years because they were told not to, and then feeling like everything's controlled, and then all of a sudden get in a car and maybe a bright light, or something happens, and that's the stimulus for their seizure. And then of course something catastrophic can happen from there. So they can be literally to hundreds a day to very infrequent, but enough of a sort of abnormality where it causes serious life concerns.
Now, could it potentially cause brain damage?
So, so in my world, in the pediatric world, just to give you an example, so to describe the types of patients I see, basically from the time you're born till you're roughly 18 to 20 years old, depending on your disease, you can be in the intensive care unit. So patients, the early, and the reason why that's important is most people's brain stops developing, whether that's the size and all the synapses, if you want to call it. For the most part, at least the brain growth sort of hinders or plateaus at around the age of 5. So now it doesn't mean that you can't have rewiring over time or what's called neuroplasticity, which we can talk about it, but that just means that the brain can sort of help other parts of the brain if it were to get sick. But the earlier on in life that theoretically you have seizures that can either they last a long time or they are very often can definitely cause brain damage. The majority of the brain damage that happens is if there is a lack of oxygen to the brain while a patient is having a seizure. That's probably the most significant abnormality, just very similar to like if somebody has a heart attack, you have a heart attack because you have lack of blood flow to a portion of the heart muscle and it dies. Similar in the brain, if it goes for if it has a period of lack of oxygen, then that brain tissue can die and it's destroyed. The other way I describe how it can cause brain damage is that if a seizure is like an electrical storm, like we see in the weather, but it's going on inside your brain. And so if the brain is firing and firing and firing and firing, eventually that firing can cause some permanent damage as well. So it depends on the region of the brain, because we have different parts of the brain that do different things. It depends on if the brain tissue actually dies, like what happens in strokes, where the brain tissue dies. And then it also depends on the age of the patient. The earlier the age, the longer seizures could last. Then there can definitely be brain damage. And then there's a whole onslaught of research and medical information about then the medications that those patients are on. There's also medications that have been shown to cause some lower IQ and some other issues. So the culmination of all of those can definitely cause brain damage at an early age.
Wow. So an extremely serious disease condition for children and their families to deal with.
Yeah, and then there's a lot of what we call epilepsy syndromes, where kids are born with genetic abnormalities, meaning that there's a problem with their DNA. Some of them have names. Some of them we know where on the chromosomes, which is the information area of our DNA. And some of those, just because of their genetic problems, meaning they were born with problems, are known to have some brain damage or brain abnormalities, whether it's how the brain grew or formed when the baby was inside the mother. Those just in and of itself have, abnormalities to the brain. And then if you throw in their seizures on top of it, which a lot of these conditions have, these kids, unfortunately, get off to a bad start.
Wow. Now, based on your experience, how does hemp oil or cannabis compare to the standard of treatment outside of, I guess, cannabinoids?
Great question. So, the standard treatment for most medications that are for seizures rely on a part or on a chemical, if you want to call it, that's called GABA. There's a long name for that, but it's called GABA, GABA. And most of the medications that are used to control seizures are trying to make you have more GABA in the brain, which is a slowing down. It's sort of like the brakes. If you're driving a car and you want to slow the car down, you would have a lot, when you press the brake pedal, you would be making a lot of GABA. And so the job of a lot of these seizure medications are to decrease this chemical. In hemp-based CBD, or let's just call it cannabidiol, because I think that the chemical in and of itself, I think we can use as a generic term. One of the ways that cannabidiol helps, which can be found in hemp or marijuana, is that it creates a lot of this increased amount of GABA. And so by replicating similarly to what some of these medications do that are used in the neurology world, or the world of the patients that get taken care of for seizures, it helps do a lot of raising the levels of GABA to try to slow down that electricity, try to calm it down, which is also why sometimes these medications could be used in pain, which could be used in like neuropathy, which is pain that's caused by nerve problems, but it's trying to raise some of this GABA levels. That's probably the simplest way of explaining it. There are a lot of other medications that are used that work on the cell in a different way to try to prevent the electricity, if you want to call it, the action of happening in the cells. And so there's some other medications that are used for that. And there is some literature that cannabidiol, along with some other cannabinoids, can help with that regulation across the membranes, which is the outside of the cell, to help that electricity calm down. But I would say that overall, that's probably the main number one reason why we think cannabidiol, whether it's from hemp or marijuana, helps in seizures.
Great. Now, what is, I guess, the typical standard of treatment outside of CBD? Is it Dilantin, or what's most often used?
Good question. So some of it depends on, and I'm not a neurologist, I will just start off by saying that, although we take care of pretty sick patients with seizures in the ICU. But the standard of care mostly has to do with the types of seizures that patients have, and in what realm or in what sort of environment that we're actually taking care of the seizures. So to give an example, if someone has had a seizure in the past and they recovered from it, and they go to a neurologist, which is a brain doctor, and they do a study of the brain, which can be done by checking brain waves. And there's a certain abnormality that they see, meaning it's coming from a certain part of the brain, which by definition would cause a certain type of seizures. Then there might be a slew of medications that are used for that. In my world, most of the patients that end up in the intensive care unit would be patients that have had continued seizures that don't stop despite getting medication. So in my world, we use medications like Phenobarbital, which is a barbiturate, which again, the job is to slow down the brain, which is Dilantin, and the other name for that is phenytoin. Similarly, works into the brain. There's a newer medication over the last 10 years or so called Keppra. It's got a long name, levetiracetam, which has a less adverse effects than some of the other one. But again, the job is to slow the brain down. And then the classic drugs called benzodiazepines, which would be drugs like Ativan, Valium, Klonopin. Those also help on GABA, and those are sort of an immediate short-term treatment to try to slow down the brain. Those are probably the main. Again, there's tons of them that I could go through that have different, but those are sort of the main treatments that people would start off to control the seizures.
Now, a patient comes in, they've had, I guess, a lack of response from some of the other treatments that they've had. In what percentage of cases do you see that they are having a positive response to CBD?
So that's a good question. And I'm probably a little bit skewed in two sort of extremes. So in the hospital, of course, I'm not able to go to the pharmacy and ask for CBD. However, I will tell you that in our hospital, in our children's hospital, and I've been really pleased about this, if a patient is on, and I'll answer your question specifically, but if a patient is on cannabinoids, the parent is able to bring the oil or the medication into the hospital, and the parents can administer that. The reason I'm mentioning that to your question is that I have seen patients who end up in the intensive care unit that are on medications, but end up because of their seizure disorder, despite being on all of their medications. And I will tell you that the few patients that are on it, when they're off of it for the few days because they either didn't bring it into the hospital or they whichever physician was on might not have wanted it to be involved, or for whatever the reason is, when they bring it back in and they get patients back on it, and I have seen in those patients that are on it a temporizing effect and a little bit, not all, but a little bit easier in getting them back to sort of their normalcy. In the outside world, one of the hallmarks of my clinic was I really wanted to see very complex medical children, similarly to the ones that end up in the intensive care unit. Most of those patients were on several medications. And I will tell you that I would say probably about 50 to 75% of those patients that we started, even just cannabidiol, because talking about THC in children is a long discussion because of just parental concerns. But I would say that there definitely was a decrease in the amount of seizures that they would have, meaning how many they would have per day, and then the intensity of the seizures. And that usually happened pretty quickly. Then there might be, then we might hit some plateaus and it might change, but because again, the goals of everyone coming to the clinic would be different. But in epilepsy, I would say far superior in my world to a lot of the other syndromes or symptoms that patients had. I would say that was the most, I don't want to say immediate, but short-term effect, meaning we saw it relatively quickly, and the most percentage-wise of effect. And effect, I mean sometimes people who are having many, many seizures every day and maybe seizure-free for 3 days. I mean, that's a big deal. Or even patients that are having seizures infrequently, maybe once a month, and then didn't have them for 6 to 12 months, or maybe even not all, because I haven't been doing this for a long time. So the longevity of these studies would be very short, but definitely some very good results.
Amazing. Now, do you also have experience with Epidiolex?
So Epidiolex, my experience is that I, of course, know what it is, very familiar with the pharmaceutical company, and then, of course, very familiar in the sense of that a lot of neurologists are using it now because it's now FDA approved. So for those who are listening, Epidiolex is what is sort of in the layman's terminology, pharmaceutical grade cannabidiol. So meaning it's just like you're getting something that's been tested in by the, let's just use the FDA in the United States, but whatever drug governing body that exists in that region of the world, it's been tested and to the point that it's safe to give to human beings. So when Epidiolex was coming out by GW Pharmaceuticals, this was at the time when I, of course, was already using anywhere from hemp-based products that you can get all over the world to, of course, medical cannabis from the grows that were taking place in the United States. And in my opinion, we weren't really getting anything new because you could get CBD. Now, calling it pharmaceutical grade means, again, that it's supposed to be the most safe that you can get it. And safety in all medications, and especially even off-label medications, is a big deal. So my experience, first and foremost, was knowing what it was and what it is, knowing that the goal was for it to be quite similar to what people were doing using hemp and cannabis. And then number three, it actually was, because it was FDA approved in the United States, it allowed patients with insurance to then get their insurance to carry or cover Epidiolex, which is quite expensive, outside of people paying out of pocket for hemp-based products or cannabis-based products or marijuana-based products. So that was sort of the introduction to Epidiolex. Then now what I've seen in my world, and let's call it the world right now I'm wearing is as the intensive care doctor, is I'm seeing a lot more patients who are hesitant to start taking hemp-based or cannabis-based products, but now because it's pharmaceutical grade and it's now able to be prescribed by a doctor that is covered by insurance, I've seen that a lot more neurologists are using that who really don't have a lot of knowledge about cannabidiol in general. I have a couple of concerns about that. Number one is the dosing can vary, and not that I'm an expert, but I think it is important to have sort of an idea of how you want to do it and what you're going to do. And then number two is if you do a certificate of authenticity on Epidiolex, that a certificate, if you send to a testing lab, will tell you if there's pesticides. It will tell you if there's any heavy metals. It will tell you if there's anything that can adversely affect a human being. And I'm a little uncomfortable with the amount of alcohol that's in the base of the Epidiolex. And so there a lot of medications and a lot of things are alcohol based. However, the majority of people that are going to be getting Epidiolex, because it was FDA approved for 2 epilepsy syndromes, it's going to be an alcohol based product, which you can argue about how much percentage or what's in there, but it is in there. And I don't think a lot of parents would be wanting to give alcohol-based products. So I'm not trashing GW Pharmaceuticals because I think what they've done is great, but I think people just need to have an idea of with anything they're taking, what's in there. But that's been my most recent experience with Epidiolex as it's come to the forefront.
Now, let's say if you had a child that has seizures, would you start with a hemp-based product? Is that kind of how you would proceed if it was your own child?
So let me make sure that I'm echoing your question. So your question, if my child had seizures for the first time, and where would I begin, or
where would you begin exactly? Would you start off with hemp, or would you start off with another product, or I guess how would you proceed?
Good question. I mean, I think based on what I know and based on my experience, and I'll try not to be too much of a doctor here, but I do feel that there's been a good safety profile in, let's just specifically stick with if you're and by hemp I'm assuming you mean cannabidiol, since there's no THC or less, sure, at least less than 0.3%, but specifically cannabidiol. I feel that the benefit definitely outweighs the risk of starting cannabidiol. Mm-hmm. Now, on the flip side, wearing the same sort of hat, I for your listeners, I as a pediatric intensive care doctor or just a physician rely on Western medicine. Mm-hmm. And what I mean by that is medications that we all know of that are FDA approved, technology like ventilators and mm-hmm. like everyone's been talking about during COVID. So I know that patients would not survive whether they're very ill or ill in the intensive care unit without modern medicine and what we've been doing. Mm-hmm. So to say that I would start only depending on what type of seizures my child had and how debilitating they would be, I don't know if I would solely start with cannabidiol.
Mm-hmm.
Although there are some cases where I would, but I definitely would have it in my armamentarium of what I'm using right off the bat.
Mm-hmm.
So if someone gets started, if my daughter was, or son was really, really having problems, I would start with probably a Western medicine in addition to my cannabidiol, hoping that I would only need cannabidiol. I have really good hopes, and this isn't a negative statement about cannabidiol. I think I just have to be a little realistic that the data is growing and we're all learning. And, it is, if it was my specific child, I just would want to make sure that I'm making a decision for them that's in their best interest. And although I feel very, very comfortable with right off the bat giving them cannabidiol, I would definitely do that in conjunction, at least at the beginning, depending on the type of seizure, with probably some medication. But if it's a very simple seizure type that somebody might, that is known to not be have too many seizures, that there might be, a couple of situations where I would just use cannabidiol and follow it that way. But I definitely would have it in my bag of tricks.
Got it. Now, it sounds like you would not recommend CBD as a nutritional supplement for children. Would that be a fair assumption?
No. I mean, I can very honestly tell you. Well, let's back up and take that so that I think everyone can understand. So, cannabidiol, as everyone knows, is or hopefully people know it, is a cannabinoid that exists within the plant, and so it's one aspect of the plant. It's natural, and so it within the hemp or the marijuana-based plant. So, to me, it's non-euphoric,
Mm-hmm.
and there's many benefits based on how we think and know how the endocannabinoid system works. And the endocannabinoid system, for those who are new listeners, is the system that we think that exists, that we know exists within our body, that helps keep our balance, what we would call homeostasis. So to me, this is an added nutrition supplement that would benefit anybody.
Mm-hmm.
The main thing I think that we're learning, and because of course your question could be a whole 1 or 2 hour lecture, but the main thing that I think we need to keep in mind is that the way cannabidiol, when it comes into our body and acts like some of the our body makes our own cannabinoid-like chemicals, and we could talk about that later if you'd like. But it comes in and tries to help balance what our bodies should be doing in the first place. And so the only thing that I think is very important is that because of the way our body metabolizes certain medications that we take, or how our liver works, the cannabidiol is metabolized by our liver.
Mm-hmm.
And there's a certain types of enzymes or proteins that are used to break it down. So if you're on other medications, then we have to be aware that there could potentially be drug interactions between cannabidiol and whatever that might be on. Now, if you take a patient or a child that's not on anything and you want to add a supplementation I don't see any downside to them being on cannabidiol or CBD. Outside of that, it could cause a little bit of sleepiness the first few days that they're on it. And so, that would maybe be, if you want to call it a potential side effect, depending on how they're taking the cannabidiol, if it's oil-based and what type of oil that is. Just some patients, their stomachs just might not tolerate, just taking a little bit of an oil. But but as a supplement, because of how our body's balance system or endocannabinoid system works, I would have no problem with a child being on that.
Okay. How about a pregnant woman?
Good question. So there's the data in pregnancy is all over the place, mostly because it's not really studied. Now there is some data, just taking things a little step forward, that's been coming out of Jamaica in the last few years, because marijuana is a big part of the culture there. Now in marijuana, of course, you're getting all the cannabinoids that are in that particular plant, and there are a lot of pregnant women who have been using flower-based marijuana, and whether they're inhaling it, cooking with it in Jamaica. And there is some literature in the OBGYN area, the doctors that take care of pregnant women and the babies, of of mothers using it, even breastfeeding mothers, and those babies have done okay for the most part, without quoting the exact studies. But it's, I mean, I personally know women who have taken CBD very early on for morning sickness and have had very good, good results with with that use. There's no actual data that's at least out there, meaning a prospective, meaning that they've taken, let's just say 100 pregnant women, they've given 50 CBD and they've given 50 placebo, meaning not CBD and some other base, and studied them to see if there's been adverse effects. That really hasn't taken place yet because I think people are fearful. But I have definitely recommended, and I've definitely seen women for morning sickness. Let's just use that as the most common reason that women use it. And there's been no deleterious effects that I've seen related to their children, the brain growth. Granted, now some of these children are only a couple of years old, but I think I feel like it's safe. I can't say that from an evidence-based approach outside of what I've seen. But that's a little bit more controversial, and because you're talking about two patients and the fetus, and there's just not a lot of studies in babies before they're born.
Right. Now, is CBD as effective as THC in preventing or helping with morning sickness?
Good question. I mean, I think less people recommend THC because, there still is a fear. And, although it's not completely proven that THC might, affect brain growth, I just don't think we have all that data. I would say that the majority of the people that I'm aware of, I personally really just only recommend CBD. I've been a little hesitant, mostly because I think you just have to be careful in today's world, and not that I practice out of fear, but I think I practice out of reality. And I'm not sure how much more benefit it would give just because I haven't done it very much. That specific question has not been in the literature that's been coming out of some of these countries. But I would say, unless it's knowledge that I'm not aware of and patients aren't telling me the truth, that they are using THC. But I think I'd probably feel more comfortable to get this period, pretty much only using CBD. I mean, again, I've definitely seen pregnant women who recreationally use marijuana and have used it during pregnancy, and those women's children have been completely fine. But unfortunately, that doesn't sound scientific.
Right. But it sounds like if someone is debating between Sofran and CBD, it sounds like CBD is definitely a better option to go.
I mean, I think it's natural. I mean, we can get into a whole discussion about hoping that CBD product is a good product. I mean, I'm sure you're well aware of this, and many of the people. I mean, there's been lots of studies of companies that have been selling CBD, and then individual people testing those products, and there's either not enough CBD, there's no CBD in there, or the amount of CBD that they guarantee you is not in there, or there's actually more THC than that's allowed, and maybe that was helping with the benefits. I mean, Zofran is a great drug, and obviously patients are using it and have had great results. It's pretty sedating, yet so is CBD. It works in the serotonin system. Serotonin is another one of those chemicals that we talk about all the time, which CBD helps with. That's why we think CBD can be used for depression, like some of those drugs that people use. But I think if I had to choose one or the other, and I was a little bit scared of taking medications, and I would choose CBD.
Got it. Now, is it true that cannabinoids are in breast milk as well?
So yeah, I mean, they had measured the milk of mothers, and there are some in there, and so theoretically it would cross, when patients are being fed. So there is studies that have looked at that. I don't want to misquote, because I know there was a study that just came out about measuring in the babies the levels compared to the mothers in levels, and because of the way CBD gets broken down, how they measure it and where they measure it, was a difference. But there was a study, I believe, in breastfeeding mothers, and again, don't quote me on this, that was measuring levels. And so there are some levels that come across, of course, and then it really just depends on how babies metabolize medications, because the livers are relatively immature in newborn babies. So how they break it down, There's something called the first pass effect, where it goes into one part of the body, and then it gets broken down. Then it goes to another part of the body and it gets broken down. And we as human beings and individuals can break down chemicals, differently, which is why some drugs work better for us or some diets work better for us. But yeah, there has been some studies showing that it can be in the breast milk.
I guess the question that I had was, are there endogenous cannabinoids?
Oh, I'm sorry, in breast milk in itself.
Yes.
I'm sorry, I misunderstood you.
But those were also really great comments, because I think that is something that people have asked about as well.
Sure. I mean, so my answer would be and when you say endogenous, I'm assuming the cannabinoid or the endocannabinoids that we make, like anandamide and 2-AG.
Right.
Is that what? Yeah. So I mean, we know that what's in the mother is in the blood. I mean, sorry, is in the breast milk. So for instance, if a mother is on narcotics, that's why we don't recommend breastfeeding, is the baby can get sedated from narcotics. So I would imagine, and again, I don't have scientific evidence, and I guess I don't know the exact answer, but I would imagine, based on what is mostly in breast milk, and a lot of those nutrients are coming from the mother, that there would be some cannabinoids in there, or endocannabinoids. But to be honest, Taya, I'm going to look that up, because I think that's a fascinating question, and I probably should know that. But so I'm going to make an assumption that it is, but I don't have the scientific data to answer that completely.
Okay. What I had heard was that there are endogenous cannabinoids in the breast milk, and that is why little babies sleep right after they have mother's milk. That's
yeah. I mean, again,
concept. Yeah.
Yeah, sure. I mean, just the way nutrients get passed on in breast milk. I mean, again, I'm fairly positive that you're exactly correct. But since I haven't read it, I'm trying to be as honest as I can.
Awesome. So we talked a lot about seizures, but what are some of the other conditions you've seen in pediatrics where, I guess, cannabinoids have promise?
Sure. So by far, as we mentioned, seizures is at the top of the list. And then after that, it sort of branches off relatively quickly. The most common reasons for patients coming to see me were, again, number one, epilepsy. Number two would be different autoimmune diseases. So autoimmune disease means that the body is unfortunately making or attacking itself. It's interpreting it as not itself. And so it thinks that it needs to get rid or attack or get rid of it. So diseases that we're aware of would be things like rheumatoid arthritis, which affects the joints. And there's different kinds that exist in kids versus adults. There's Crohn's disease or ulcerative colitis, which are diseases where the body, again, doesn't recognize itself. And Crohn's and ulcerative colitis mostly affect the GI tract. However, there's a lot of what we call extra-intestinal, meaning outside of the intestine, manifestations like horrific arthritis and rashes, or even affecting the kidney. There are a lot of autoimmune diseases in children that cause pain. So, which, to be honest, was one of the really exciting patients that I saw, because a lot of them I did not know, despite me being in pediatrics, that had chronic pain. So probably the classic one is the short term is EDS, but Ehlers-Danlos syndrome, which is can affect the joints and can affect the gastrointestinal tract. But basically, where I would put those would be in autoimmune pain syndromes that affect children. So the autoimmune diseases would be sort of in there. And then probably the next most common that I saw was related to cancers or malignancy. And those would be for several reasons, meaning there would be three tiers that a patient with cancer would come to see me. Number one would be is if they have a cancer, they've been going through therapy. Unfortunately, their cancer or tumor was not getting better. They might have been told that, or the family been told that they have X time to live, or that there's no more options for them. So they were looking for maybe two things. Number one, potential longevity or more of a comfort life. Number two, or comfortable life. And then number two would be patients who are really looking to hopefully stave off or help with their actual cancer. which there's less data of that, but there are some good case reports. And then, of course, patients with cancer that had sort of end of life issues like pain, difficulty with sleep, knowing that this was sort of the end, but wanted to, create the best quality of life that they could. I would say those would be the top three, and then right in there, 3/4, or anywhere in the top four would be pervasive developmental disorder, which is another name for autism. Autism used to be the generic term, and it's still probably used generically, but the technical term is pervasive developmental disorder because there's so many different forms of autistic-like behavior. And even though autism in and of itself in most states is not medically, is not a diagnosis that's allowed, they have a lot of issues that do fit into categories. Like there's a high incidence of seizure disorders in autism. There's a high incidence of patients with autism who walk very tight, and so they get a lot of tightening and muscular spasms. And then, of course, their behavior. So those, I would say, are the sort of top four. And then there's a whole, whole list of other things. But those would be the top four. And autoimmune, obviously, as I mentioned, as a number three or number two, but that obviously encompasses the big tree of all the diseases that can be an autoimmune disease.
Now, let's say I'm a parent and my child is experiencing one of these conditions. How can I get proper treatment for my child?
Good question. In most states, so let's back up. When it comes to hemp-based products, and again, for the listeners, hemp and cannabis or marijuana are considered two separate plants. Again, a whole nother botany lesson, but it's regulated differently than it is marijuana. So as most people who are listening know, you can obtain cannabidiol from a hemp-based product. And what makes something hemp by definition means that it has less than 0.3% THC. So barely anything, nothing is in there. And you can buy that across state lines. So for instance, if you just go on the internet and type in cannabidiol, you can buy from hundreds, probably thousands of places all over the world, and it can get sent to you. So one, you could purchase it that way. Some companies, although they're not really legally allowed, they can make recommendations as to what they think patients should start. But if you were going down that route, let's just say you live in Florida, in my state, you could purchase CBD, and I would have a lot of people reach out to me who purchased products and wanted to get guidance onto where they start. And even before telehealth, I would see a lot of those patients because again, I wasn't seeing them to recommend a card. We could do phone conversations or telehealth visits, and we could talk about that. And I would give a long dissertation about the endocannabinoid system and how it works and why we use it in dosing. So that's one way to do it. The other way, in states that are medical, you could then seek out a licensed medical cannabis physician, which means that they took a course required in their state. And if the doctor felt that they qualified, they can then go through with getting a medical cannabis card, and then they could obtain CBD or cannabidiol from marijuana-based products from dispensaries. And most of the dispensaries have products that are pretty much only cannabidiol, and there's nothing in there. The caveat to a card, and I would say I don't know the laws in every single state, but the majority of states that do have medical cannabis do require that a second physician be on the application process, just because it's a minor. And so a second physician would have to sort of okay the application process. In Florida, it does not have to be a physician who's a licensed cannabis physician. So for instance, if a patient was referred to me by a neurologist who has no interest in medical cannabis, but they feel that the benefit outweighs the risk, they would sign a form for me, and they would then qualify. So you can get it online if you're getting it from hemp. You can get it from a company, a dispensary, if you have a medical cannabis card. But to be honest, I've learned as much from parents as I think parents have learned from me. And so because CBD does not have euphoria, a lot of parents, I would say, have been much more comfortable buying and starting it on their own. So, in that sense, they're really just sort of winging it and doing it by themselves, or there's a lot of parent portals now where people are giving guidance, or even doctors who have guidance online. But those are probably the two easiest ways to go about getting cannabidiol.
Now, there's so many different varieties and dosing percentages. Do you have any recommendations for like a good start?
Yeah, I think a good start. I mean, look, word of mouth, always helps. I mean, you could even type in on Google the top 10 CBD companies, and most of that has to do with sales. Although there are some, pretty good ways of, looking to see if that's reputable. I think overall, the one thing I recommend, I mean, what I would do in my clinic is I would have if you came to see me, I would have a big, huge, old school binder. Part of the binder would be learning about the endocannabinoid system, which takes about 20 to 30 minutes. The next part of the binder has what we call, and I brought it up earlier in the talk, COAs, or Certificate of Authenticities. And again, that is companies that are able to test the product, and hopefully it's a reputable testing company, because that's, again, a whole nother discussion. But they're the companies that are there, and I would use very similar companies. But I think it's very important that the product gets tested. So again, in part of my big binder, I would have companies where I have tested what I consider very good products, and have those Certificate of Authenticities, A, from the company, because all companies should provide that, and B, ones that I tested independently myself, so that I could see that they were consistent, and showing parents. And then I can make recommendations by saying, here are the companies that I've tested, that I've personally used. There's not a CBD company that I've recommended that I've not personally used myself. And then that way I can provide with them. And then I've even taken the steps. So for me, there are some companies who have been so kind to give a discount code for me, because again, most of this is out of pocket, or for my patients, I should say. The discount code, and then they would be able to get even further of a discount. So it helps everybody. We've got good testing, got good products, but I think that the Certificate of Authenticity is very important. The word of mouth with the Certificate of Authenticity is very important, and trying it yourself. Again, I'm a big proponent, because I think the downside of CBD is so low, because I use it a ton for sleep, because everyone has problems with sleep that has a disease or has symptoms, and you have to get people back to sleep in order to fix everybody's problems. And so I would even encourage that to, even most of my friends, families, professionals, a lot of us who, just work a ton for a living, and you can try it yourself, and that way you feel even more comfortable.
Any particular brands that come to mind, or would you like to share?
Yeah, I mean, without,
yeah, no,
sure. I mean, look, so Miriam's Hope has been very kind to me out of California, and I'm just going to give a little kudos out to Dr. Bonnie Goldstein, who's in Los Angeles, because I trained with her for a little bit, and she helped me to get in touch with them. But they gave me a discount code. It's ExAlt Med. It's basically the name of the company, ExAlt as in Tom, M as in Mary, ED. Green Rose, of course, they were very kind to me down here, which is out of Davie, Florida. And they've been around for a long, long time. A lot of people have used Charlotte's Web for a long period of time. And, I know they've gone through some, rebranding and changing lately. But they were, of course, hit the market nice and early, and people have been very happy with their products. There's Pure CBD, which is another company, Pure, and I think Calm is another one, CALM. But those are sort of the few right off the top of my head. I mean, I could give you about 15 or 20 other really good ones, but without selling anyone out, so to speak, those are the first ones that come to mind.
Okay, fantastic. So it sounds like the one thing that parents need to make sure is that they don't make that decision based on price on Amazon, so that they do some research into the reliability of the products that they're purchasing.
Yeah. And I think the most important thing that people also need to know, there's obviously price gouging in every business, but what people really have to be careful is when you look at a bottle and you look at what number is in there, meaning the amount of milligrams, it's unbelievably variable. What I mean by that is most bottles are 30 milliliters, which is 1 ounce. And so what people will look at the bottle is it says 200 milligrams or 500 milligrams or 3,000 milligrams. 95% of the time, the number that is on the bottle is the total number of milligrams that is in the bottle. So for instance, if you see 500, it's most likely that there's 500 milligrams per 30 milliliter bottle. And that comes out to roughly 16.6 or so milligrams per 1 milliliter. There are so many parents who used to call me and say, hey, I have this bottle and I'm giving them 200 milligrams at a time. Now, not that that's not possible, but that's a lot for people to start with. And so most of the times that's a 200 milligram per 1 milliliters. Again, so you're basically getting whatever 200 divided by 30 is. I'm not smart enough to do that off the top of my head. And so, you might not getting very much. Now they might say that it works, but again, when you go online or when you're buying any CBD from anywhere, and it's the same thing at the dispensaries, although they'll point that out because there'll be price differences per different bottle, but you really got to be careful as to how much you're getting in the bottle, because if you have 3,000 per bottle and the same size bottle has 500, and or someone tells you to take 1 milliliter, which you can draw up in a 1 milliliter syringe, that patient might be getting anywhere from 17 milligrams to, something a lot higher. And so there's no deaths that have happened from CBD. It does not decrease your breathing like narcotics do. So just want to throw that out there, that that overdosing is close to impossible. But, in terms of getting the medicinal benefit, it's really important that you look at the bottle. And if you're probably getting something really, really cheap, it's probably because there's not much in there, or it may not be that great. I don't want to throw anyone under the bus, but if you look at the prices, the average prices are pretty much for an average 1,500 milligram bottle of a decent product. I'm just going to say around 100. So there might be anywhere from $75 to $200, but somewhere between $100 and $150 for a 1,500 milligram bottle, which in theory, depending on your disease or symptom, could last, anywhere from a couple of weeks to a month, depending on the size of the patient.
What's the minimum effective dose?
That's really patient specific. And and I just was participated in a conference last night. It's not only patient specific, but it has everything to do with what our hydration status is, how we absorb the medication, how the medication is being administered. So for instance, an oil-based product, that's placed under the tongue. You're supposed to hold it under the tongue so you get some effect. Well, what happens if that 5-year-old child, or even an adult, if you ever try to hold something under your tongue for 30 seconds, it's pretty hard to do. So holding it under the tongue, you're supposed to get something. And then, the rest of it gets absorbed as it goes through the GI tract. I would tell you that there are some patients who swear that 1 milligram or 2 milligrams of CBD helps them. Wow. I'm not in a position to say no. I will tell you that there are some people that take 50 to 100 milligrams, need that. What concerns me about CBD in any world, whether it's coming from cannabis, marijuana or hemp, is because everybody processes it differently. Depending on how they're doing their extraction, there's a lot of ways to extract. Not 5 milligrams in one CBD is not the same as 5 milligrams, unfortunately, in another company. And the example I give to everyone is that when you go to Walgreens, CVS, Safeway, depending on where you live in the country, and you go and buy Tylenol, when you take 15 milligrams of acetaminophen or Tylenol, it's the same no matter where you get it. And unfortunately, that doesn't exist. So it's a laundry list of things. Are you getting what you pay for in terms of the milligrams? What is your hydration status? What is your nutrition status? Are you taking it with a fatty meal? Are you taking it on an empty stomach? All of that, as I've learned personally from myself and from patients, is the key. I think is in terms of your original question is what's the minimum amount? Is you got to do it consistently to really get the most bang for your buck. Consistently with the time, consistently with the diet, and consistently with the brand. Once you find something that you like. Now,
is it better to drink water with it or have a fatty meal? What's the best way to increase absorption?
So the way cannabinoids in our body are formed is what's called across the lipid, across the bilayer, the cellular membrane, which is made with fats. So classically, the way it's in terms of the way it's made and in terms of the way it absorbs, usually with a fat base is usually the best. So that's why a lot of the cannabinoids are oil based. Number one, it sits in there and it helps with the absorption. I can just tell you personally, and let's specifically just talk about oil, that if I just exercise for an hour in the morning, or I exercise an hour earlier than I would normally take it, and if I'm not as hydrated as enough, my effect might be different. And I'm slowly learning, for me, that when I'm relatively dry or an empty stomach, that I don't get the same effect as when I might have eaten a really good, and I don't eat a big breakfast, but if I have my protein shake with my fruit, and then I take it, I get a much different effect than if I didn't. So I think that's important. When it comes to, flower and an inhalation, because you can smoke straight CBD. There are companies that sell CBD, joints or blunts. That's a whole different bag of worms, because it's going immediately into your airways and immediately into your bloodstream. And that's why most people like flower, because it's completely inhaled differently. I think the future and the best route that I think is going to exist when it comes to all of this is going to be, an inhaled, sort of like people that have asthma and have a meter dose inhaler, just because I think that's going to give the most consistent effect. Now, it's going to be hard for a 6-month-old to use an inhaler, but I think that's just sort of the future as we learn more about what's called the pharmacokinetics, meaning how we absorb and metabolize medications. But I think all of those things are really important in terms of the best way to take it in terms of your diet, nutrition. Consistent. I would recommend having a meal. It doesn't have to be fats per se, but something that's just going to be a little bit more, heavier when you're doing it. Specifically talking if you're using the GI tract.
An inhaler doesn't currently exist. Is that correct?
There are some companies in Florida, for instance. There's a company called Trulieve that has an inhaled meter dose or an inhaled THC. It's sort of marketed as to replace. It could be marketed however it wants, but when it first came out, it was to be used for patients that, like, let's say, were having seizures and trying to get that stopped. So, for instance, there's a rectal gel that can be given called diazepam. And that's used as a rescue medicine. So there was a sort of a marketing of, and I don't want to mismarket Truly, but that's how, at the beginning that they talked about this, but marketing as one of the uses of THC, and it was used through an inhaler. But I'm not aware of a lot of companies that really have gone down that route as yet, especially, at least in Florida.
Okay. I know we talked a lot about children just because of your area of focus in medicine, but are there major differences between how children process cannabinoids versus adults? I hear such diverse stories about how some people see great benefit with CBD and some people really get no benefit at all. And it seems to be so varied. Do you feel that there's differences in adults versus children in the utilization of these compounds?
So my quick answer is going to be yes, but I don't think it's for the reasons that you're probably thinking. So let's, again, not to put people listening through a science lesson, but the endocannabinoid system, again, the system that we know exists that helps balance our body, interacts with all of our organ systems. So our heart, which is called the circulatory system, the lungs, the pulmonary system, or respiratory system, and I can go on and on. But the job of this system is to function efficiently and keep us in what we call homeostasis. So in general, all of our endocannabinoid systems function very differently. Yours is going to be different than mine. And that's why the hallmark sort of things we think about with the endocannabinoid system is what makes us hungry, what makes us not hungry, what makes us stay awake, what makes us want to go to sleep, what makes us remember, what makes us forget. Those are sort of some of the things that the endocannabinoid system is doing. So all of that is different for different people. So my answer is that it's because of our endocannabinoid systems and how it functions. There's people who believe in what's called an endocannabinoid deficiency syndrome, which because it's not working well, it's causing a lot of symptoms and maybe even disease. Fibromyalgia would be probably the best example of what people think that dynamic of that disease process might be. But so if your system is functioning different than mine, then me just taking CBD, which remember is only one chemical, if you want to call it, that we're giving. It's just like if you're just giving vitamin C to somebody, you know, that person might not need as much as somebody else, or their system might be functioning well, or it might tip them in one way or the other. So a baby versus a 7-year-old versus a 16-year-old versus an octogenarian, an 80-year-old, you know, they're all going to have different systems. So that's the reason why, to me, it's such an exciting field, because everybody's different. And it really is, you know, to me, a custom-based, individualized approach. And as we learn about more cannabinoids, it's going to be even more fascinating and understand people's genetics really well, so that we really can manipulate people's endocannabinoid system, similarly to how people's systems get manipulated through medications that we take for diseases now. So the answer is yes, because our own endocannabinoid systems are so different.
Mm-hmm. Awesome. Well, thank you so much for sharing all this information. I do have one final question. If patients wanted to reach you, is there a path to do that, or are you currently practicing in this area?
Sure. Thanks for asking. So I'm not the most savvy social media person. My clinic, which right now is I have patients. My patients are being taken care of by some colleagues, because since I am a medical director, I can't legally recommend, at least be a recommending physician for a card, but I do some consultations. My website is www.exaltmed.com, and it's EXALTMED. And you can even communicate through with me, and it comes to my email. I'm fairly good at email and can set up things. Probably the biggest social media I do is on LinkedIn. So if they look me up on LinkedIn, I look a lot towards that. Those are probably the two best ways, either through the clinic, again, which you can come to my email, or reach me out on LinkedIn that way. My cannabis world is sort of separate from my pediatric intensive care world. So going through the hospital I work at, which is called Joe DiMaggio Children's Hospital, just in case anyone ever wanted to find where I am most of the week. You know, there's a website, but cannabis is really not something that comes through, or the endocannabinoid system through the ICU. But I think those are probably the two, you know, easiest ways. And I'm pretty good at calling people back, especially if they like being called at 2 or 3 o'clock in the morning when I'm in the ICU. And that's when I usually check my emails and stuff. But those are the two, outside of giving tons of other emails, which I'll get overwhelmed. But that's probably the best way.
Perfect. And we'll put those links in the notes so people can find you if they need to. Any last minute remarks for patients or the audience?
No, I think the best thing, you know, I enjoy your questions, because I think it covers so much. I always wish that there was, you know, more time, because I think we all focus on a lot of the same things right now, because most of what's going on in the medical marijuana / hemp / cannabis world is really focused on rec versus medical. But I just think the thing that I would tell people is the endocannabinoid system is real. Mm-hmm. The endocannabinoid system is scientifically proven. Mm-hmm. And so the reason why we think all these cannabinoids and chemicals are, and I hate to use the word chemicals because they're natural, but the reason why we think this all works is because we all have a system and it works in different ways. Mm-hmm. And that's the controversy of it. That's the frustrating part of it, but it's also the exciting part of it. And so I just encourage people who are interested to read PubMed, if you could get into PubMed, PubMed, which is sort of the national physician or anybody in education that looks for articles. There's a lot of scientific data if you want to get, you know, really scientific. There's a lot of really good people out there who have been, you know, making really good sites and teaching. I'm going to be teaching and providing lectures in an academy called Advent Academy, ADVENT, which is going to sort of be a CME, or continuing medical education for professionals in the cannabinoid or endocannabinoid system world. And that was started by the Knox's families, which is out of Oregon. You know, be careful, ask a lot of questions. Don't be afraid to challenge your physician or friends, because everybody has the answer, and just educate yourself, because this is going to be the next, you know, 10 to 15 years of medicine changing. And, we're definitely at the forefront of another type of medication. And I think it's exciting. But there is a lot of, things out there that are untrue or being marketed. And everyone has to be careful, just like in anything else they put into their body.
Thank you, Dr. Exelbert. Thank you. This was a great reference, I believe, for parents, and thank you for making yourself available for any additional questions. We look forward to continuing this conversation with you very soon. And again, thank you for jumping on.
Thank you for everything, Taya. It was so nice.
Thank you. Bye-bye.